Welcome back to Brightside. February is Heart Health Month, and all this week we've been bringing you ways to keep your heart healthy. Heart disease is the #1 killer of Americans, but cardiologists say 80% of it is completely preventable. And it's hard to talk about heart health without addressing cholesterol. So let's dive into what you need to know this morning. Cardiologists say cholesterol is directly linked to heart disease. It tends to climb with age, especially in women. So what do we need to know about it? First, your numbers. Experts say your overall total should be under 200. Your HDL, the good cholesterol, should be over 50 in women, 40 in men. And the LDL, or lousy cholesterol, should be under 130. You want it even lower, under 100, if you have a higher risk of heart disease.
You cannot feel your cholesterol, so it has to be checked through a blood test.
Cardiologist Dr. Elizabeth Clotis says her rule of thumb for most patients is get checked twice in your 20s, 3 times in your 30s, 4 in your 40s, every other year in your 50s, and annually after that. When it comes to taking control of your numbers, diet is key.
So you can eat to build health or you can eat to build disease. It's actually not the cholesterol in the food that matters so much. It's really about the quality of the fats and the quality of the carbohydrates.
She says avoid the saturated fats and processed carbs.
Apple's good, applesauce less good, apple juice bad, brown rice good, white rice not as good, Rice Krispies bad.
Choosing to make those cheap meals the exceptions instead of the rule at your table will no doubt spill into your overall health.
We eat right for cholesterol. We're not also eating right for cardiovascular disease prevention. We're eating right for cancer prevention, for dementia prevention. I mean, it is so important to think about, food intake as, as a health intervention.
And for the ladies this morning, Dr. Clotis shared another sobering statistic because we hear so much about breast cancer, especially in women. 1 in 30 women will die from breast cancer. 1 in 3 will die from heart disease. So that just gives you a little bit more perspective there on the numbers. Time for us all to take control of what we can.